dignitaries on the dais, national and international faculty and delegates, friends, I think I can start wishing you all a good afternoon. We're supposed to start in the morning, but we're starting good afternoon. That all happens in a scientific conference. I was wondering since the morning session all about dermatology. When I was in medical school, it meant something about venereal diseases, it meant sexually transmitted diseases, and during clinical rotation we were exposed to some leprosy, and we were exposed to a lot of tinnitus, and we were exposed to some form of acne, and probably if we were lucky we got some pemphigus cases. And that is what dermatology meant to be then. Over a period of time, this dermatology has expanded and grown. It has become a very unique specialty with its own niche, with sub-specialities, and cosmetology has added a lot of color to this specialty. I know a lot of you delegates here are very young, and you're also very enthused because cosmetology has actually revolutionized dermatology, not only in this country but across the globe. And there is an ever-increasing demand of cosmetics. This demand is there because of various reasons. One of them are socio-economic factors. There have been a burgeoning and blooming middle class. There are a lot of people who are now aware or made aware by the mass media and the social media. And I remember reading a joke about a few years back on the WhatsApp, which said that a baby elephant was talking to an ant, and the ant asked the baby elephant, "What is your age?" And the baby elephant said, "I am 1 year old." He said, "My God, you look so huge." He said, "Live boy se now, tandrusti pao. Live boy hai jahan, tandrusti hai wahan." Then he asked the ant, "What is your age?" And ant said, "I am 15 years old." He said, "My God, you don't even look 2 years old." She said, "Fair and lovely lagao, asli umar chupao." So that was cosmetics, and that's what mass media has done. It has promised much more actually than we can deliver, and that is where the challenges lie in front of you. That is what I want to bring to the notice of all the young dermatologists here, that you are the final deciding factor in what is to be done and what is not to be done. What can be done, what may be done, what should be done, but like what the erstwhile, I think, Vice President or the President of ILEVL had said, that it is from disease we are moving to desire. We are moving to need-based dermatology. Need whose need? It is the patient's needs. Are we encouraging it for personal gains? Do we have our ethical dilemmas? We have, because this growing population, if their desires are not met, if their expectations are not met, there are going to be legal repercussions. And you will find yourself a lot of obliging lawyers who will catch on with these patients and take you to the court of law for procedures which probably they will feel will not result in the desired expectation of the patient. So we have to be very careful here. Therefore, my advice to all of you is, look after the ethical component of cosmetic dermatology. As well as I know a lot of plastic surgeons are here. In my time, plastic surgery was how to go with sutures which are scar-free and cleft palate and cleft lip. Then there are emotional-based people, emotional-based clientele, your middle-age group and the neglected spouses. They will come to you to get an enhancement done. Then there are, of course, certain occasion-based marriages. The brides would like to come to you. Now there are packages for brides. There is a face package, there is a nasal package, and there is a liposuction package. There are so many packages for brides, for grooms, as well as for the inquisitive relatives and those happy relatives who want to attend these weddings. So these are some clients which are going to come to you. There will be some psychiatric clients coming to you with body dysmorphic disorder, with a lot of narcissism personality disorders, histrionic personality disorders. There will be people who come to you probably who have got hirsutism, which is because of an endocrinological cause. You have to differentiate all these to select your clientele, which is your correct clientele. The second advice I give you is the pre-operative procedure is very, very important for us. And the pre-operative procedure means a good medical history, a good social history. There may be patients who are coming from one dermatologist to another dermatologist, going procedure after procedure and remaining unsatisfied. Such patients are threat to you. Don't entertain them, because they will never be satisfied. Therefore, this social history is very important. The other part of it is in history taking. Please do not forget that what you have anti-aging is not only aging in the skin. The patient is not aging in the skin. The patient is aging in the heart. The patient is aging elsewhere in the body too. Are there comorbidities? But those comorbidities will delay healing, wound healing. The comorbidities will result in excessive bleeding. They may be an antiplatelets. So please do a very important thing is please do a detailed workup. Just don't go by only simple procedures. The another thing which is important is counseling. Please counsel the patient and please take informed consent. And when I say informed consent, there are two types of informed consent. One is the ethically delivered informed consent, other is the legally delivered informed consent. The legally delivered informed consent is this is the procedure, these are the side effects, these are the alternatives, these are the risks, these are the benefits, please sign here. This is a legally delivered informed consent. And ethically delivered informed consent is not moment-based. You give the patient time to decide. He has time. So an informed consent delivered over a period of time is an ethically delivered informed consent. And also explain to the patient the post-operative complications. Don't promise more than what you can deliver. If you follow all these, please remember, communicate what you document and document what you communicate. If you follow these principles, I think at least legally you are safe. And you will realize that ethically also you are safe. For being ethical, I only leave one question to your mind. Whenever a patient comes to you, you know he has accessibility, he can afford the care, you have availability of technology. Remember one thing, is the procedure appropriate? And how to know whether the procedure is appropriate? Apart from the scientific knowledge, please look into yourself, introspect. Will you do the same procedure in an economically backward patient who has incapability to pay? If you think you will do the same procedure on him, please go ahead and do it. And if your answer is no, please do not do the procedure. I thank Dr. Vivek and the organizing committee for giving me the honor and privilege to be here amongst all of you. These were some of my views which I wanted to share with you. I hope you will keep it at the back of your mind. I know और चीज़ों के लिए वक्त नहीं है, and I say सारे नाम है मोबाइल पर दोस्ती के लिए वक्त नहीं है. कॉन्फ्रेंस में अंदर आने के चाय पीने का वक्त तो है, लेकिन अंदर बैठ के लोगों को सुनने का वक्त नहीं है. वक्त नहीं should be removed from our dictionary. Okay, we have time for everything and make time for everything, including yourselves. Thank you very much and Jai Hind.
Thanks a lot, sir.